Okay, we are going to go ahead and kick this off today. Thank you so much for attending today. My name is Annie Lindekugel. I'm the Executive Director for the Community Services Network, and I'm excited to present in partnership with many different organizations today, the Community Capacity Building Funds webinar. Today it's brought to you by PacificSource Community Solutions, Trillium Community Health Plan, Jackson Care Connect, which is a part of CareOregon, Columbia Pacific CCO, and HealthShare of Oregon. These are our presenters today. At the very end, there will be some contact emails in a slide deck that you can tap into should you have any follow-up questions, but just wanted to highlight and give a big shout out to all of our presenters and all of those who participated in this collaboration today. We will have the Q&A section open should you have questions as we move through this presentation. We do have some awesome staff who are working to make sure that, that the questions are answered to the best of their ability in real time today. But we will also follow up with an email next Thursday with a slide deck and a copy of the questions so that you can see those on a piece of paper as well. So that will come to you next Thursday. So today's agenda, we will go over the health-related social needs benefit. We will also go over the community capacity building funding, which is what we're discussing primarily today, and the HRSN service provider requirements and expectations, and the community capacity building funding application process overview. I do see that there are hands raised. If you can add your question in the chat, that would be super helpful. Thank you so much. Okay.
All right, thank you. Hello, I'm Leslie Neugebauer. I use she, her pronouns, and I'm the Vice President of Community Health, Social Needs, and Health Equity at PacificSource. I'm happy to be able to kick us off and speak to the most recent waiver elements that have us gathering here today. I'll start just by talking a little bit about how we got here, starting with a bit of background regarding Oregon's current 1115 waiver. So every 5 years, the Oregon Health Authority has the opportunity to ask the federal government for permission to waive its standard set of Medicaid rules, which allows states to cover more people, cover more benefits, or deliver care in a different way. So you might hear this referred to as the 1115 waiver or the demonstration waiver, or sometimes just the waiver. For all intents and purposes, those are the same things. The current waiver's overarching goal is to advance health equity, and there are 3 specific elements that are spelled out in the waiver to help achieve this. The first is around OHP coverage expansion. The second is around preventative health coverage. And the third is around a new benefit called health-related social needs, which is the basis of this webinar. And I'll dive into more about that next. Next slide. Kendra, Annie, are you advancing slides? There we go. Thank you. So what we'll be talking about for the rest of the presentation is the connection between these new health-related social needs benefits and the associated community capacity building funding grant opportunity. So these community capacity building funding grants are intended to create an adequate network of health-related social needs service providers, as there's an understanding that there may be some infrastructure needs for community partners to be able to participate in the healthcare delivery system. There are some specific allowable uses for these funds, which my colleagues will go into more detail about in future slides. Next slide. So health-related social needs, or HRSN, are unmet social or economic needs that contribute to poor health and well-being. And you can see some of those examples in the graphic on this slide. Addressing social needs are important for many reasons, one of which being that they can account for as much as half of an individual's health outcomes. And the health-related social needs benefit will provide support for 3 specific social needs: housing, food and nutrition, and the impact of climate on health. Next slide. One more. Okay. Actually, you can just do them all. Thank you. The information here illustrates the specific services and supports that may be provided in each of these 3 social need benefit categories for eligible individuals. There's an additional requirement for these benefits that focus on outreach and engagement of individuals who may be eligible for these services, and potentially eligible individuals will be proactively identified, assessed, and connected to services and supports as appropriate. Requests from health-related social needs connectors and/or health-related social needs service providers will also be reviewed for eligibility and authorization of services as supported by these benefits. And you'll get these slides as a reference. Next slide. Thank you. So this is a high-level overview of who is eligible to access health-related social needs services and supports. Similar to other Medicaid-covered benefits, there is eligibility criteria that individuals must meet to be able to access these services through their health plan. This benefit specifically focuses on individuals experiencing life transitions, but also includes several other requirements. So first, the individual must be a current OHP member, Oregon Health Plan member, enrolled in a CCO or on fee-for-service, sometimes called open card. Next, in that second box after the first plus sign, they must be experiencing at least one of the significant life transitions listed in this middle section. And finally, they must have both a social health need, meaning a need for food, housing, or climate supports, and a clinical need, such as a chronic health condition, a behavioral health condition, be of a certain age, or pregnant. There are many more criteria. This is just a smattering of and some examples of some. Next slide. So this is the current timeline for the health-related social needs benefit rollout. Climate supports go live in just a few days, and the housing benefit is scheduled to launch in November for individuals who are at risk of homelessness, which is they're using the OHA, Oregon Health Authority, is using the HUD definition for at risk of homelessness. The food and nutrition benefit is scheduled to launch in January of 2025. They're just kind of a disclaimer, this is our best knowledge to date. This has been a very dynamic space, and we will learn much more in the coming months in our regular work sessions with the Oregon Health Authority. So now I'm pleased to pass it to my colleague Stephanie to take it from here.
Thanks, Leslie.
Yeah.
On the next slide, we're going to start shifting from, Leslie shared a little bit about what the HRSN benefit is and who's eligible. So we wanted to talk about who will provide these benefits and what ways will community partners be involved. So each coordinated care organization will be responsible for developing a network for the HRSN benefit. So this is really similar to how the CCOs have medical networks made up of primary care clinics, hospitals, behavioral health providers, and others. So there are 2 different types of organizations that will be part of that network. That includes HRSN service providers and HRSN connectors. So when we use the term HRSN service provider, what we're referring to is those organizations that will be contracted with the CCO to provide one or more of the HRSN services. So that could include an organization that's a private or public social service organization, a community organization, a clinic, or other organizations that already provide climate, housing, and food supports. HRSN service providers, because they will be in a contract with the CCO, will need to meet some additional requirements and qualifications to serve in this role. And we'll talk about that in a little bit. But the other type of organization is an HRSN connector. So this term refers to any organization or individual that would be helping someone fill out an HRSN request form and submitting it to their CCO to request that housing, food, or climate support. This could be similar to HRSN service providers. A variety of types of organizations could serve as an HRSN connector, such as community-based organizations, clinics, libraries, churches, schools. And this role could be a really good fit for organizations that are already sharing information about health benefits or helping individuals or families navigate to resources in the community. So HRSN connectors won't necessarily be contracted with the CCO. So because of that, there aren't as many requirements as there are for HRSN service providers to participate. So on the next slide, we'll take a closer look at some of those requirements for HRSN service providers. So as I mentioned, each CCO will be developing a network of HRSN service providers to provide the housing, food, and climate benefits. So the Oregon Health Authority has given the CCOs some minimum standards for what those requirements are. And these requirements will be further defined in contracts with the CCO. So some of this might look a little bit different depending on the CCO in your region that you'd be working with. So some of these requirements are things that you and your organization might already be meeting, such as having strong community relationships or being able to provide trauma-informed services. But some of these requirements might be things that you'd need to develop or build capacity for, such as responding to and sending closed loop referrals, invoicing for services, and this last box on the screen, able to comply with all reporting and oversight requirements likely falls into that category. So on the next slide, we'll take a closer look at what some of those reporting and oversight requirements might be. So some examples of what this might include are documenting specific information about the services you provided for each member. So that could include documenting who received services, what service they received, when they received it, the reasons they received it, tracking benefit eligibility, especially for some of the HRSN benefits that are time-bound, such as 6 months of rent assistance, maintaining compliance with HIPAA data security requirements, participating in annual audits, and verifying that HRSN support is adding on to instead of duplicating existing or state or federally funded services. So this list of things might not be things that your organization is ready to do today, and that's okay. That's exactly what the community capacity building funding is for. So it will be important as your organization considers this funding opportunity to really think about some of these requirements and the resources you would need to build this capacity to participate in the benefit. So to help support that planning, I'm going to pass this on to Maria, who's going to share more about the purpose of the community capacity building funding and the funding categories.
Thank you, Stephanie. So, we love acronyms, and this is might be a new acronym for you, CCBF, which is what Stephanie just mentioned, Community Capacity Building Fund. Just a quick overview in terms of how much funding the state is receiving, which is $119 million. That will be distributed right through each of the CCOs. So the funding might look and be a little bit different in terms of the amount, and it is over the next few years. So it's not like one lump sum that will come in the first year, but it will be distributed throughout a couple of years. The purpose of the funding, right, is very much in supporting that capacity building for community partners that are interested in becoming an health-related service needs service providers. And so that's the intention, right, behind this capacity building. This funding, right, as you heard a little bit at the beginning it is coming from the waiver, right, that ask that we did to the federal government of saying, hey, we want to do things a little bit different in terms of how we provide Medicaid or Oregon Health Plan. And kind of each state has their own options, and but the funding that's coming from the $119 million, it is coming from the federal government. So again, quick note, is intended to support that capacity building to be an HRSN service provider. Go ahead in the next slide. So what type of organizations are eligible for the capacity building fund? Well, you could be an organization that is providing housing, food, climate, outreach and engagement services. Again, it's intended to serve Oregon Health Plan members. So whoever you are, already serving or providing care to have to be connected to the Oregon Health Plan or Medicaid. There's also organizations have to have an interest, right, in building that capacity or infrastructure to meet the health-related social needs service provider requirements, which Stephanie talked a little bit about. So there has to be that intention of, at the end of the day, we are interested in becoming that service provider. Go ahead in the next. There's some animation here. Oh, no, go back there. And examples of who can apply. This is just a list that comes from OHA in terms of who is eligible to apply. So anywhere from tribal governments, community-based organizations, social service agencies, food and nutrition service providers, traditional health workers, city, county, outreach and engagement providers, and providers of climate services and devices as well. Go ahead in the next slide. Some of the categories of where this capacity, because capacity building can mean a lot of things, but from the OHA guidance, we are looking at these four different, all of the CCOs are looking at these four different categories and supporting capacity building around technology, development of business or operational practices, workforce development, outreach and education, and convening. Go ahead in the next slide. These are just some examples of kind of what would go under each of those categories. It is not an extensive list, and I believe you will be receiving also a link that will give you a little bit or additional examples that come from OHA in terms of what would be considered around our technology. But as you can see here, like software purchases could be considered capacity building for under technology. For business practices, it can look at, your organization might need some support in policy or procedure development, training, right, for your staff around health-related social needs, benefit and the roles, and some administrative support. In terms of workforce, we do have some guidance in terms of how much, right, of that of the funding can you use for staff positions. For example, with this one is staffing positions can get funded up to 18 months. There's also support for recruiting and certification. Let's say if you have traditional health workers that need, that certification, that is something that is also can be supported around workforce. And then outreach and education and convenience. Well, that kind of says a little bit of what the intent is for building that outreach and events, learning collaboratives, and community engagement activities. Again, you'll get kind of a fuller list, but these are just some examples of requests that can come in for capacity building funds. Oh, go ahead and back it up a little bit. Yes. One of the things that you will also be able to see is that there is a CMS, Center for Medicaid Services approved health-related social needs, like a mouthful there, infrastructure protocol. And so we do have a little bit more guidance in terms of, again, the intent of this capacity building. These are all public, documents, and I know kind of towards the end you'll get a list of kind of where those additional resources are, so you can take a little bit of a deeper dive in terms of some of these funding examples. And now I will pass the mic to Dominique.
Great, thanks, Maria. Hi, everyone. I'm Dominique Lopez-Stickney. I use she, her pronouns. I'm Trillium's Senior Director of Medicaid. And I'm going to close us out today by reviewing the community capacity building application process. CCOs will manage the majority of the CCBF funding, except for funds earmarked for tribal governments. And organizations interested and eligible should apply directly to the CCO or CCOs operating in the counties they intend to provide those HRSN services within or for. Applicants can apply for multi-year funding, but all funds must be spent by the end of the waiver demonstration period in September 2027. Applicants can apply for a grant regardless of the HRSN service that the applicant is planning on contracting with the CCO for. For example, it could be one or more of the HRSN benefits, housing, climate, nutrition, and then outreach and engagement as well. Applicants can also apply for a grant in coordination with other organizations. Organizations can apply to more than one CCO if the funding requests are different, so they can't be duplicative. It can be for two different things if applying to two CCOs for grants. I want to draw our attention to the right side of the slide, the grant timeline. Starting in 2024, applications will open March 1st, and the grant window will go through May 31st of 2024. And then awardees will be notified around July, September timeframe. Funding will be dispersed August through October timeframes. And then in 2025, we're aware that there will be more funding available. However, more details to come on the specific timeframes and windows. Moving on to application requirements, all CCOs will use the same application template. The application questions will include categories like your organization's information, attesting to eligibility to be able to provide the HRSN supports and benefits, information about population and counties that will be served through the HRSN supports with your organization, some questions about your organization's background and specific to the funding request you're applying for. And there's an application and a companion resource to that is a budget template that applicants are also required to submit as well. A few more details about requirements in the application process. All CCOs will use the same evaluation template, which is also posted to OHA's website. One of the slides at the end of this slide deck is resources, and there is a link to a few of OHA's sites as well as the different CCO sites. And so you'll have those resources as well. While all CCOs will use the same application template, each CCO will have specific instructions on how to apply. Key takeaways from today. We've got 4 key takeaways. The first one, the window to apply for the capacity building funding in 2024 starts March 1st and goes through May 31st. There'll be another window in 2025. Community partners who apply for funding intend to contract with one or more CCO to serve as an HRSN service provider for at least one HRSN service. And that is one of the attestations in the application that you'll see. Third, the capacity building funding, it builds infrastructure to prepare community partners to provide HRSN services to eligible OHP members. And last key takeaway, the HRSN service providers have requirements and responsibilities they must meet.
All right. Well, thank you so much, everyone, for presenting such important content. And just wanted to make sure we leave you all with these links that you can, when we send out, you can click on them and they will give you some more up-to-date information. And I just want to also acknowledge that this information is coming out so fast, and also will be coming out additional information as it comes out. The health systems and health plans will make sure to share that information with you. So the CCOs, my apologies, the CCOs will be able to share it with you. And the place to go to for the information. Also, if your CCO, say, is Columbia Pacific, this would be the place to go to find additional information in the future. So all of those links and contacts are here with PacificSource coming in the near future. And I see that there are questions. So just a reminder that the Q&A is open. It has been recorded, and I do want to apologize. We had made every intent to make this accessible to 1,000 folks, but something happened with technology and that did not happen. So we'll make sure that the recording goes out today to everyone. So if you had colleagues who weren't able to attend, just please know that this information will be shared with all of you. And we will also submit an opportunity for you to share Q&A as those folks review this recording in the near future. Let's see, Maureen, would you like to go over any specific questions that have been asked already?
Hi, Annie. Sure. Let me pull up the document here and see if I can go through a few of them. We've got a lot of really wonderful, relevant questions today, and I just want you all to know we have some people that are kind of working behind the scenes to try to get answers out to you all for questions that we know we can answer today, and we'll be working to get answers to other questions that we don't answer live today out to you all next, hopefully next week, as soon as possible. So we had questions around, I think actually maybe I'll pick some themes here. I'm seeing a lot of questions around like becoming an HRSN service provider and providing services and contracting with the CCO. So I think I'll say to that question, yes, if you want to become an HRSN service provider, you will need a contract with the CCO to do that. Alternatively, if you're just working with individuals who you think might want to access these benefits or be eligible to access the benefits, you can refer into these benefits, help your the individual you're working with get a referral in to see if they could be eligible for the benefits. Anyone can do that. So you don't need to be contracted with the CCO to help the person that you're working with get a referral to the CCO to see if they would be able to access these benefits. So hopefully that helps. I saw a number of questions that kind of were around that topic. There was also some questions around whether you could apply to multiple coordinated care organizations for this funding. The answer to that is yes, you can. There is a spot on the application that asks if you have applied for to multiple coordinated care organizations for funding. We know organizations serve, multiple service areas that may include multiple CCOs. So the answer is yes, you can apply to multiple CCOs, and just make sure that you indicate that on the application when you submit it. Let me scroll here and see a few other questions. There's some questions, there's some specific questions around documentation, other technical support that might be available, systems that you might need to have. I think the best answer for that is that I know the CCOs are all thinking about how to support providers and additional technical assistance that might be needed. I would say contact the local CCO in your service area and ask those questions specifically. So some CCOs may have a documentation platform that they're planning on using. Some of them might have some additional technical assistance that they're able to offer. Some of them might have some processes that they're thinking about that we felt like were just a little too specific to go into in this statewide webinar. So I just encourage you to connect with your local CCO, and we have all of that listed on, I think, the last page of the PowerPoint. We would love to hear from you. There was a question around how would we know if the CCO wants to work with us? I think this has been interesting as far as like getting to know our community, and we're sort of asking the same thing, like who wants to work with the CCO? And so again, use that contact information, send us an email, tell us a little bit more about, what interests you in this, and we can, work with you on kind of what comes next as far as like where your interest might lead you. So that might be sort of CCO and region specific. Let's see. There were some questions around organizations that are eligible to apply, and I don't know if someone could put the slides back up around those organizations that are eligible. I think we had them listed on one of the slides. that might be helpful just to look at again. There's a question here. Can non-HRSN providers apply for CCBF funding? So yeah, so right now, you know, there are, as we build this benefit, we are working toward this new, I would say this new definition of health-related services, health-related social need service providers. And so yes, if you are providing services or it feels like you do work in the spaces that we're talking about today, contact your local CCO and talk with them about your interest in potentially becoming a provider. And you don't have to know whether you want to become a provider. I think that's the CCO's job to help you figure out, you know, is this something that you, that's a good fit for you? So I would just encourage that contact as well. So if you have any interest, reach out. We want to talk to you. See additional questions. And if any of my colleagues are in the spreadsheet and want to help answer any questions, I would welcome that as well. More questions about like if you work in multiple areas, how should you know, how do you know who to apply to or who you should apply to? Again, I would just reach out to the coordinating care organization that's in your local service area. Or reach out to both of them at the same time. We know in our metro area, both Trillium and HealthShare in that area. And so we would welcome questions from you all about what you might be thinking as far as interest in becoming a provider. Let's see. Yeah, application timeline. So the application it opens March 1st, but really this is a long application window. We're still getting information from the Oregon Health Authority and sort of thinking internally around how we're going to do this work. So there's no rush to apply. You know, near that March 1st deadline, we really want to think about this application closes May 31st. And so all applications will be reviewed once the application closes. There's really no need to, they're not going to be reviewed on a rolling basis.
Can I ask a question?
Sure.
I was just wondering, so the application process starts in March and ends in May. So when we're looking at the first phase, which is climate, second phase is housing, and then to food securities, are we able to submit applications for either one of those programs as soon as March, or would you like, or are we staggering out the focus of the application through March and May?
No, so it's just one application that will be live. It'll be the same application that's live March through May. Hopefully this answers your question. Same application that's live. And if you provide food services, we want you to apply in that window. If you provide housing, however you see yourself in this, that is the application window to apply for funding for this year.
Thank you so much.
Sure. See, I'm going to keep scrolling down here and look for themes.
I think we have one other hand up.
Sure.
Shayna,
Sure.
would you like to go ahead?
Yeah, hi. Thank you all for hosting this meeting. I just had a quick question around contracting with CCOs. Are you recommending that we reach out to our local CCOs and let them know that we're interested in possibly becoming a provider in order for us to contract with them? Or is there a process where we can fill out an application to be contracted with the CCO in order to apply for these funds?
That's a great question. I would reach out to your local CCO and ask them that question in your service area. I think that, you know, the CCOs are expecting that most organizations who might want to provide services will need some of this capacity building funding to get started. And there is, you know, an expectation that if you're applying for this capacity building funding, that you will become a service provider. Or that everyone has the best of intentions moving forward, that you'll be then becoming a service provider, meaning you'll be contracting with the CCO. So I think, you know, in this time period where we're all, you know, thinking about all of these things that many of them were sort of just learning, I do really encourage you to reach out to your CCO and ask questions that you might have about network building, what needs they have, what you think you can provide, and work through that with them. It's going to be different around the state, what the needs are and how people are thinking about doing their network building to support these benefits. And if any of my other colleagues also want to chime into any of the answers to these questions or how you are thinking about it, feel free to do that.
I'm wondering if I could ask a question.
Sure.
So I couldn't figure out how to raise my hand, but we are currently contracted through Trillium CCO. We have a grant through them right now, which involves some food insecurity needs. If we were going to continue to want to expand through this capacity building endeavor, our food insecurity distribution stuff, what exactly, because it sounds like this funding is simply to build capacity and not actually providing the service yet. Like, is this with the expectation that more funding will come to provide the actual service, or am I misunderstanding in that this funding is both for capacity building and service provision?
I don't know if one of my colleagues from Trillium wants
Yes.
to.
Yeah, thanks, Maureen. Yeah, hi, this is Dominique from Trillium. Yeah, and I saw that in the chat as well. It may have been from someone else trying to get some clarification on how does the capacity building funding fit in with, you know, HRSN, maybe like billing or invoicing and payment, and how I visualize it in my mind. And I think you put it really well is the capacity funding is going to help build that infrastructure or capacity in organizations that would like to become an HRSN service provider. And so it's for really specific things, which was on one of the slides, but also has more details in the application itself. And then, so that's kind of like if we draw a line there, and then if an organization becomes an HRSN service provider, there will be an invoicing, billing, you know, payment, reimbursement, all that stuff. So like the actual providing of the services, whether it's installing a AC unit for the climate, or it's, you know, providing 6 months of rent assistance for housing, or medically tailored meals for the nutrition benefit, that's separate and distinct. So yes, you have that correct.
Okay, yeah, and that we would be, for example, if it was for medically tailored meals, we would be hiring staff and creating a plan and infrastructure to create those meals and putting all of that together. And then there would be additional funding coming in to like support the staff and the actual meals.
For providing that service. And yes, so that's correct. Somebody just escaped my mind. So for the nutrition, yeah. So for like a food box or medically tailored meals, that would be separate. So yes, this capacity building funding is to get an organization ready to be able to do that. And then, oh, this is what I was going to say. So this would be, these HRSN benefits are for OHP members who are eligible. So it's not for every OHP member, but once they go through that eligibility and screening, and it's deemed, yes, they're eligible, then that is where that reimbursement will come in for each eligible member that the organization provides that service for.
Okay. One last question. If we were to also apply for the housing portion of it, Could we provide infrastructure just to provide rent insurance for our participants, or do we also need like housing navigation to get them into like provide housing ourselves, or like actually like find the housing and communicate with landlords and do that whole process? Or could we simply provide rent insurance and have infrastructure around that?
You know, I think
Not rent insurance, rent reimbursement, sorry.
Yeah, I think those are all really good questions. And I think up to the, you know, information that we have at this point, we're just getting into the planning for housing and nutrition. The CCOs are with OHA. So I think more really granular details to come. I think you're along the right lines, but I think let's connect offline and we can go over some like specific questions you may have to make sure that, you know, we're answering them accurately, but just kind of with like limited information that we have right now for housing.
Okay, absolutely. That'd be wonderful to connect with you offline. Thank you.
Thanks, Annie.
Yep, absolutely. So we'll take 2 more questions. I have Sarah and Josh that have had their hands up for a while. We'll take those 2, and then if the rest can include your information in the Q&A. And like I said, we will respond to all of those questions. I think we have a total of 52 in there right now. And so just want to make sure staff has adequate time to answer those. So Sarah, let's start with you. Thank you.
Thank you. And Annie's question answered one of mine, so that was helpful. But the other one is, so we currently provide many of these services but we have a fairly limited service district. We're in the Silverton area. We serve our school district. So would we be able, if we became a contracted provider through a CCO, would we be able to continue only serving our region, or would we have to serve anyone who's eligible through that CCO for these services? Anyone who came to us?
Sarah, that's a great question. I don't think I have an answer for you on that right now. I don't know if anyone who is in any of the my CCO partners who are in your service area want to jump on with a answer there.
I'm happy to connect with somebody offline too, but just wanted to ask when I had the opportunity.
Sarah, if you wouldn't mind maybe adding your question to the Q&A as well. That way.
It's in there already.
Then they're great. Okay, my apologies. Great. So I think what we'll do, it sounds like that one might be a good one to answer offline. Is that, Maureen? Okay, great.
I think, yeah, that would be great. I think the answers get a little convoluted. So, but we'll do our best to kind of write out our thinking around that. It's a great question, Sarah. It's one I think that we can get some information back to you on. There's been a lot of questions around volume, and so I think that aligns really well with kind of getting back to you on that.
Perfect. Thank you, Maureen. And thanks, Sarah. All right, Josh, go ahead.
Yeah, thank you. Question was in the Q&A, but it's about, do you have a range of expected awards or a maximum at this point?
That's a great question, Josh. I think what I'll say, there was a webinar actually yesterday that OHA put on, and we can get some information out about how you could watch the webinar and get the slides to that. But ultimately, there aren't dollar amounts that I think are being put out right now. Partially, all of the CCOs have a different amount of funding for the capacity building. And so I think OHA didn't want to put sort of dollar limits on CCOs. And also some CCOs have different needs than others. And so right now, that's not something that we are that we've established. As we get further into this work and start thinking more about this, it's possible that some CCOs might be able to kind of look toward what they're interested in funding or what they know they need to fund and put out more detailed information. But I don't think that's something we have right now. And again, if I'm speaking out of turn and any of my other CCO partners want to chime in, please do so.
Yeah, Maureen, I'll jump in. This is Elliot. So Elliot Sky from PacificSource. I just wanted to share, I've seen some of those questions in our chat that are around kind of that process of determining what CBOs might be prioritized, what kind of applications, what the CCO regions are going to be looking for in their network of benefits. And I think all of that kind of ties into that question that you were just asking, Josh, about how much money or what's going to be prioritized. And that's all up in the air right now. That's all being discussed internally with OHA. There's a lot of discussions around what it makes sense to prioritize within networks. It's really about creating a network of providers in each region that can really reach as many beneficiaries as possible. So as many people on Medicaid who would qualify for these benefits. It's about building out a robust network, and nobody has a clear cut, this is the right way to do it. So we're not being told this is the way you're going to do it. Here's how much money you're going to give. So it's all in process right now. So wish you could give more concrete details, but just know that this is partly the reason why I think you keep hearing, we keep saying to reach out to your your CCO, take advantage of that contact email that's provided and reach out and make connections and share your ideas and be a part of the process, because it's all evolving right now.
Well, thank you both.
Thank you so much. I just posted the emails again, just in case you missed those earlier. If you'd like to reach out to your CCO, these are the emails that you should use. And let's see, anything additional? Would anyone else? I know I see Lucy, you have a question. Do we have time for one more question? Okay, Maureen says yes. Lucy, go ahead.
Sorry, I put it in the chat. Let me see. So it was just can you hear me?
Did you want to share it? You can.
So it was just around, I kind of jumped in pretty late, but like reimbursement and this funding are we able to, depending on the organization, potentially get funding up front for smaller organizations, if that's like a barrier? And then I forgot what the other one was.
Lucy, that's a great question. I would again say just reach out to the CCO in your service area and ask them that question about how they're going to distribute funding. They'll be able to give you more information.
This is Elliot again. I'm going to just bring up one more thing that I've been seeing in the questions in the Q&A. It's about kind of what the process is going to look like for CCOs when CBOs create partnerships and take on HRSN funding. These are being built out individually by CCOs, and it will look a little bit different depending on which CCO you're in. There's a billing process, a reimbursement process, and OHA is working on as much uniformity as possible to make it as easy across multiple CCOs, because there may and probably will be CBOs, community-based organizations, that are going to contract with more than one. But each of those right now is looking like there's going to be differences for each one. So again, in terms of questions around specifics of how what the processing and invoicing, what different specifics around billing is going to look like, or reimbursement, reach out to your CCO.
I also asked if there were slides, if they're going to be sent out as well.
They are, Lucy. We're going to get the slides and answers to the questions sent out, and I'll pass it to Annie and she can share a little bit about that.
You bet. You bet. Thanks, Maureen. Yes, we will have the slides sent out as well as the Q&A and the answers. And then also the recording from today's presentation will be sent out afterwards. Like I mentioned earlier, that will be all to you. All of the answers to the Q&A will be to you by Thursday of next week. I will try to send out the recording link and the slides a little bit sooner, because I do realize that we had a little bit of technical snafu today. my apologies for your colleagues maybe who weren't able to attend the presentation. So we will send that out sooner. And with that, I would just like to thank all of you for attending today, and thank all of our presenters. If our presenters and those behind the scenes could just give a wave, maybe turn your screen on and give a wave real quick, just so folks kind of see who you are. Great. Maybe a few. There we go. We had a lot of folks behind the scenes working in the chat or in the Q&A as well. So thank you to everyone, and more to come on this information. As stated earlier, there's a lot coming down every day on this, so stay tuned. Thanks again, and we hope that you have a great rest of your Thursday. Take care.
Hey, Annie, can I ask a question? There are a lot of questions in the Q&A. Did I miss the part about why we didn't take the time to address as much as we could while we have some minutes left? Because I don't think I can save or download these questions, and I'm seeing a lot of great ones, and I can't keep up because there's over 100 of them.
Yeah, no, you will get a document with the Q&A in it. So don't worry about seeing it in the actual live session itself. So you'll get a follow-up. The reason being is that because there's different CCOs, we just want to make sure we take the adequate time to respond appropriately to the questions. So that is why we cut it at just a little before 1, just to make sure that we can adequately answer the questions. And so we will get those to you shortly. And then also, Sherilyn, you can connect with the CCO in this region to make sure that you have that email to message them directly as well.
Thank you.
You bet. Thanks for attending. I think we just have our presenters on now. I think we're wrapping up. I'm going to go ahead and stop recording here.